There's a lot of people out there getting some not so welcome letters from the Social Security Administration, actually from Medicare about their Medicare Part B premium, their IRMAA, income related monthly adjustment amount. And they might be paying several $1,000s more per year. So we're going to talk about that. Also got someone that says Starlight 11. Now, this is also a live Q&A. So if you're watching this on a recording, make sure you subscribe, like, and share, and all that kind of good stuff. Come back here if you ever got any questions. You ever get any weird letters, come back here and we'll walk you through it. So looks like someone says, funny you're talking about Medicare penalty. I'm one who didn't sign up for 5 years later. I go to, and yes, a hefty penalty that's ongoing. Plus, I can't get it until January 2026 during the open enrollment period. Yes, unfortunately, this is April. You just missed the general enrollment period by this much. So we're going to talk about that penalty as well. So we're basically going to talk about 3 Part B penalties, extra premiums, surcharges, whatever the case may be. One on your Part B because of high income, another one because as Starlight 11 didn't sign up when they were supposed to. We'll see if there's an exception there. And there's also the Part D penalty as well. So we'll talk about those today. And if you got any questions, make sure you type them down there. And I'll get to I'll get to it as many as humanly possible here. Okay, so what is the IRMAA? It's basically Congress decided this a few years ago, and it's in order to kind of save Social Security or save Medicare. There's not really, Congress really hasn't done anything to save Social Security in the last few decades, but with Medicare, they've established these extra surcharges for high income earners. And it's basically, it affects about 7%. And then basically you sign up for Medicare Part B, and everybody in the country pays $185 per month for Part B, unless you made a lot of money a couple of years ago. And then there's actually a logical reason. It's unusual for the government to do things logically, but there's actually a logical reason why they use your income from 2 years prior, because they don't get it until the following year and they have to project it future. So, but it's a logical reason why they do it 2 years back. But that also opens up the ability for you to appeal that, so you don't have to pay the Part B if it's not applicable to you. So basically, there are calculations that if you are filing individually your taxes and you make over $106,000, then you're going to be paying an extra penalty. In terms of $106,000 to about $133,000, you're going to be paying an extra $74 per month for your Part B. If you're going to make over $500,000 a year, your MAGI, which is basically your modified adjusted gross income, you're going to be paying an extra $443.90. So your Part B penalty is your Part B premium is going to be $628.90. And then there's also a Part D, the prescription drug part as well. So the max you will have to pay is the $85.80. And then it's different. I'll put this in the description, but you can also see this on Medicare.gov and SocialSecurity.gov, the current numbers if you're watching this later. So if you're married, if it's over $212,001, then you're going to be paying the extra premium. And what usually affects a lot of people that they're very, very surprised is they sell a home, and when they sell the home, they get hopefully a profit from that home. They make more than what they put into it, and that counts as capital gains. And if it counts as capital gains, guess what? That is part of your modified adjusted gross income. Social Security counts that. So in terms of your MAGI, it's your income, your net income from business. So there's a lot of different things that count as your modified adjusted gross income. And the one that surprises everybody is the selling the home. So when you sell your home, but there are exclusions. The IRS accepts, exclusions for everything, right? When the capital gains exceed the exclusion amount, and what is the exclusion amount? It's for if you're single selling your home, you're excluded up to $250,000. Anything over $250,000 counts as your MAGI. If you're filing jointly, it's $500,000. And this can't be a second home or, anything like that. It has to be a home that you've owned for 2 years and lived in as your primary residence. So again, 2 years ago, if you sold a home, you just might get an extra Part B and a Part D premium increase. And how do you get rid of that possibly? Well, in terms of selling the home, if you get the extra Part B premium because selling your home, I've taken thousands of these appeals for people, and unfortunately, they're denied because Congress did not make an exception for money coming in from selling your home. So you can appeal that, hey, the money, I'm not a high income wage earner. I just sold a house a couple of years ago, and so I shouldn't be charged. You can appeal. You can appeal anything, but that one's going to be denied. If you were working and you were making over that amount 2 years ago, and now you're charged with the extra Part B premium, if you've stopped working or you lost income or you got divorced or you got married, whatever the case may be, there are what's called life-changing events. You can file what's called an SSA 44, SSA 44. It's a life-changing event. You fill it out. It's pretty easy to fill out. You fill it out. You turn it in the Social Security Administration. And if they approve it, then they will no longer charge you those extra premiums for Part B and Part D. And now, considering Social Security is way, way understaffed, it might take them months to process it. If they overturn, the extra premium, then they'll overturn it since, the beginning of whenever you started, January or whatever that particular year. So if you don't get it approved until like July, then from July going forward, they won't charge you the extra Part B premium, and they'll go ahead and return all your monies going back to January. That is if they approve it. Okay, so what other type of penalties? So Starlighter was talking about if you don't sign up for Part B when you're supposed to, and that is for most people when you turn 65 years old, or if you're on disability, and after 24 months, you're entitled to Medicare, via your disability. If you don't sign up for Medicare at those times and you don't have an exception, then guess what? Yeah, you're going to be penalized 10% for every 12 months you did not have Part B. So I think the commenter said they were 5 years late. So you're going to pay 50% extra. And 50% of what? 50% of whatever the Part B premium is for that particular year. This year it's $185. So you're going to pay the $185 plus half of $85 every single month for the rest of your life. The IRMAA is just for 1 year. So if you've sold your house, you get a bunch of income, then it's recalculated every year. If you continuously making $1 million, then you're going to get a Part B premium surcharge every single year. But if they recalculate it every year, but in terms of the Part B premium, because you didn't sign up when you were supposed to, that's forever. You're going to ever and ever and ever. Same thing with Part D. It's not 10% for every 12 months. It's 1% for every month you did not have Part D, the prescription drug plan. And 1% of what? That's a little bit more complicated. They do it basically on the average of that particular year, the Part D plan. So this year it's about $30 and some change. So 1%. But hey, if you're 5 years late, that's 60 months. So that's 60% above and beyond what you have to pay for Part D, your prescription drug plan. And the commenter was right. You can't do anything. If you don't sign up for Part B when you're supposed to, the only time you can is during the general enrollment period, January, February, and March. So if you sign up in January, your Part B will start in February 1st. They changed that law a few years ago. It used to start in July, but now it starts the next month. And yes, you will be charged the extra premium for the rest of your life, unfortunately. Again, you can appeal anything, but that one's going to be denied, unfortunately. All right. So if you've got any other questions about any of those, you wanted me to go more into deep, but we've got tons of questions here I want to be able to get to. So let's start off this. And again, as always, chapter Medicare, if you need any help, finding a Medicare plan, make sure you reach out to them. They sponsor this live Q&A. Okay, Mayor, I was on disability as a widow. Now I'm on retirement survivor benefits. Can I collect my retirement now with it? I'm 68. Okay. So you were on disabled widows benefits. That means you started you were disabled and you filed for benefits on your I guess your husband's record or wife's record, um, and deceased record, and then you turned your full retirement age, and your disability benefits switched to retirement benefits. So good, everything is going perfect because nobody nobody is on disability after their full retirement age. Everybody is switched from disability to regular retirement benefits. I think I'm going to do a video. President Biden just gave his speech, just came out of just semi-retirement. First time he's appeared, and he was talking about the number one thing he talked about was Social Security, which I thought was great. But he kind of said something that was wrong. So I'll talk about that later. It's basically this. He basically said, you've got this elderly person that's 70 years old, wants to file for disability. There is no disability after your full retirement age. So I understand what he was saying, but anyway. But in your particular case, okay, yes, you can. But do you want to? Because you have been on surviving spouse benefits. First, it was surviving, disabled widows benefits, and now it's just regular widows benefits, surviving spouse benefits. You're collecting benefits on your deceased spouse's record. Your record over here, you haven't touched, sounds like. So those benefits are just going to go up and up and up. Every month you wait to collect benefits on your own record is going to go up until you hit 70 years old. So that's what I would do. I would call Social Security, or you can go online to My Social Security and find out what your PIA is, your primary insurance amount, or call them and say, what's my PIA? And they'll tell you. And then if it's more than what you're currently receiving and you need that extra money now, go for it. But and then ask them, says, okay, if I wait till next year, how much more is it going to be? If I wait till I'm 70, how much more is it going to be? And then you make that decision at that time. So, but call them up first, find out how much it is now. And if it's more and you need it now, then go for it. If it's going to be a lot more in a couple of years and you can hold off a couple of years, then definitely hold off. But yes, you can switch back over to your all. A lot of people miss that. The offices, they get a report on a regular basis. Offices, the 1,200 plus offices throughout the country get a report. It's called the WIB-RIB report. And it's basically for those people in that district, that area, that part of the country that office serves. It says, hey, in your area, you have 100 people that are receiving widows benefits like Mayor there, but benefits on her own record are more. Maybe he or she doesn't know about that. So here, send this letter. So the local Social Security office sends those letters to those people, but unfortunately, they don't get the letter. They don't understand it. They think it's, they don't open it. They don't take action, and they're losing money. Or now maybe those letters are not going out because Social Security doesn't have any people anymore. It's been pretty much gutted. Steelers football. Sorry, it's a Social Security question, so not sure if you will answer. Absolutely. If I have a Social Security online account, am I able to file for Social Security benefits, or do I still have to go to an office to file? As of 3:14 p.m. on April 18th, 2025, we never know what's going to happen one day to another nowadays with Doge Social Security, but as of right now, you can file online and you're good. So if you've got an online account, if you're able to go in there and do everything online, what happens is you go ahead and file, you push the button, and then someone else from the local office or someone in that area will review your claim. And if everything is good, they adjudicate it, they process it. If they need something, like birth certificate or, whatever, then they'll reach out to you, and then you just might have to go down. So it really depends on your particular situation. But yes, you can definitely start it online. If we are on regular Medicare, are we being forced to get on Medicare Advantage? As of right now, April 18th, yeah, the new sheriff of CMS Medicare is Dr. Oz, and he really likes Medicare Advantage plans. So I'm keeping an eye on it. Make sure you subscribe and all that kind of good stuff, and that way I can keep you all up on all the changes. Right now, no. So right now, no. If you have regular Medicare and that's all you have, you're not being forced, but if that's all you got, then unless you got a few $1,000,000 sitting under your mattress somewhere, you got to get something else. If it's not a Medicare Advantage, my regular viewers know I always, always, always recommend looking at Medicare supplement plans first, a plan N, a plan G. Check those out. So whoever you talk to, your cousin or nephew that does, helps people with Medicare, insurance, reach out to them and say, hey, don't tell me about Medicare Advantage. Tell me about Medicare supplements first, N and G. Okay, now what's the difference between a supplement and an Advantage plan? And then you can make a decision, once you get all the information. But you can also reach out to Chapter and they can help you out. But yeah, if all you have is Medicare alone, then you got to get something. Either, again, a Medicare supplement plan, a Medicare Advantage plan, unless you have like Tricare. If you got Tricare, retired military, then you're good. If you've got Medicaid as well, you might benefit from having a Medicare Advantage dual eligible plan. You might get some more benefits there, but it really depends on what's available in your area. People that have that use Veterans Affairs. If you know anybody that's a vet that has just, they didn't sign up for Part B or whatever the case may be, because of what's happening with the Veterans Affairs, the VA clinics, that they're going to be, letting go tens of thousands of people possibly. And so the service is going to get a lot worse. A lot of people were like, I don't want Part B. I don't need this. I don't need Medicare because I use the VA, because the VA is awesome and they've been taking care of me and yada, yada, yada. We don't know if that's going to continue. So it might be a good idea to get a fallback. And again, this is the same situation where Starlight 11, if you didn't sign up for Part B and now you want to, if you don't have an exception, and the exception is for that penalty is if you had health insurance from work, current work, yours or your spouse's, and your employer had 20 or more employees, or if it's a large company, 100 or more employees on a group health plan, if you didn't have that, then yeah, you'll get the penalty. But if you have that, let's say you work for a company and they have 20 or more employees and you turn 65 and you're like, I got health insurance from work, or I got health insurance from my spouse's work. I don't want to pay the $185. Good. You made the right decision. Continue working, spouse continues working, and then 5-10 years later, once you stop working, then you can go ahead and sign up for Medicare, and there's no penalty whatsoever. So you just have to fill out a couple of forms, and you're good. Bunny, hello everyone. Happy Good Friday. Hello and happy Friday. Planning for 2026. My IRMAA will be higher from selling my house in 24. Yes, you figured it right. Thanks to your Social Security Alone series, I know I can't appeal. Yeah. Does the IRMAA tier chart include the $185 or added to the chart amount? Yeah. So let me pull it back here. So let's say you are individual. Where did my thingy go here? Okay, there we go. Let me take this off. All right. So yeah, so if you made over 106,000, so you're going to pay $74. The surcharge is going to be $74. $74 plus $185 is $259. So that's how much. This is how much extra you're paying, 185, and then the total what you're paying would be this amount. So, yes, and again, I always try to be correct. Technically, you can appeal, but they're denied. Yeah, Congress. And I would reach out to your politicians and say, okay, I know the IRMAA thing and it's good, high wage earners are going to pay them more and yada, yada, yada. But Congress really, 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 really should have made an exception, because they like making exceptions for everything, right? For their billionaire patriots. But for elderly people that have retired and their families have left and they've got this, maybe this big house, or they're tired of living in the city. They don't need to be near work anymore. So there's so many people that, in their 60s, they go ahead and sell their home and downsize or move to another part of the country. And yeah, they shouldn't have to pay an extra, Part B premium for a year because of that. So Congress should have made an exception to that. So Nana Dona, I would reach out. I doubt it does. I doubt it'll happen by the time you start, but maybe you'll help somebody else. So reach out to your politicians and say, hey, you should make this exception. So thanks for all you do. Don't let the haters discourage you. I know you know what you're talking about. Thank you. I appreciate it. I'm an old Marine Corps sergeant, so the people that attack me, and it's like, come on. Drill instructors would have been embarrassed at that personal attack. You got to do better than that. So Staff Sergeant Lone had taught me well. I applied for 13 and received email today saying application is approved, and that will be receiving benefits letter between 10 and 15 days. Wow. Okay. Good deal. Sounds like everything is going good. So maybe you filed online or through a phone appointment, and they said, hey, we received everything. Everything is cool and copacetic. We need to review it. And once it reviews and we do the calculations, then you'll receive a benefit letter and it'll tell you exactly, how much. And they need to fix the glitch on this one, but because your claim is pending, don't freak out when you go into my Social Security, into your My Social Security account, and you can't see anything. For some reason, it's once you have a pending claim, it kind of shuts off the My Social Security account, so you really can't see anything. So don't worry about that. It's just a glitch they need to fix. Is the government giving us a bigger pay this April? No. I've seen something online where someone's saying the president gave $7 trillion to Social Security and stuff like that. But that's just some social media person, trying to cause trouble. Charles, why don't you talk about payments being on time for May? Why don't I talk about planes not falling out of the sky? I don't know. They're okay. They're on time for May, as far as we know. I have to pay income tax on my Social Security. How do they know to put it back in the fund? It's automatic. That's automatic. Once anybody pays Social Security tax, because when you do your taxes, the Social Security knows that. So you've got your W-2 wages over here, and you've got a little separate category on your, tax form. And it says you're paying this much tax on your, W-2 income. And then you put your Social Security part, and it shows that, 50 to 85% of your Social Security benefit is tax. So the IRS knows. And then once they collect those taxes, then it goes into the Social Security Trust Fund. So I've actually got, so this is the Social Security Trust Fund. This is 2023. The 2024 numbers aren't out yet. So in 2023, they got $1.1 trillion coming in. And where did that money come in from? Mostly FICA taxes, people working, paying W-2s, but also 49.8 billion came in from taxes, exactly what you're talking about. So, and then 63 billion from interest. But the problem is this much came in, that much went out. And what covered the difference? Luckily, the trust fund. But now the trust fund is slowly being depleted. So we need to do something. We need to get our politicians to get on the ball and get it fixed so we don't get cuts in the future. So let me see. Hey, Tweety Bird, long time no see. I am entitled to ex-spouse benefit, survivor benefits, married 19 years, never remarried, collecting my own now. Social Security office say they can't add my name to the ex's MBR until after his death. How will I know that? You'll get a check. So once you're entitled to benefits on that person's record, they will file a claim. And then, so once you file a claim and you're starting getting benefits from that person's record, your LAF code will show from there, and you'll have a BIC code from that particular, so you don't need to know how the sausage is made. But once you're entitled, then you're on that person's MBR, master beneficiary record. So that was probably way, way too technical, too much information you didn't want to know. Can you recommend a good attorney to represent an SSI applicant? An SSI applicant, those are usually difficult because supplemental security income, lawyers, they're running a business, so they would need to make money. Um, so I I don't have anybody in particular. I always recommend local lawyers, local disability lawyers, local lawyers, that handle Social Security disability claims. Reach out. They probably got billboards all over your city. Why local and not these big, national sweatshop, law firms, is because the local lawyers know the local judges. So, and they know your local doctors and all that kind of stuff. So they kind of got the lay of the land. So just find somebody local. Thank you, Dr. Weir, for all your wonderful information. You're welcome. I often pass your YouTube link to everyone I know. I also appreciate your neutral responses. Thank you. I appreciate it. Neutral except for saving Social Security. Yeah, I am 100% for saving Social Security and Medicare so we don't get checks. But other than that, I try to be. Yeah, thank you. I appreciate it. I always thank you for your time and great advice. Is SGA before, after taxes? SGA, substantial gainful activity, is your gross income. So yeah, so if you make $1,000 and your buddies at the IRS take 700 of that, then your SGA, substantial gainful activity, is your gross income, is that $1,000. Attorney not needed. I agree. For the first, if you want to hire an attorney, go for it. More power to you. If the attorneys, I always hate to talk bad about attorneys, but because they're so litigious, the attorneys say, they some of them start this rumor about everybody's denied the first time on disability, which is 100% BS. And then they say, well, if you hire an attorney, you've got a 60% higher chance of, based on statistics, you got a 60% higher chance of being approved and stuff like that, which is true because they're selective. You call them up and say, yeah, I fell off my bicycle yesterday, and say, okay, I want to file for disability. No. Oh, this one looks like a good one. This one looks like it'll definitely win. So yes, we will take you on. And then obviously you're going to get a higher percentage of approvals if you're, pick and choose. But if you want to hire an attorney, go for it. But the initial stage, when you're filing the brand new one, you're just going to fill out the application just as well as the attorney would. So you can, do it yourself. You want to hire one. The second stage, if you're denied the first time, the request for reconsideration is easier than the initial one. It's just, hey, I disagree with y'all because of this. And it takes 10 minutes to file the appeal. The third stage, that's when I definitely recommend a lawyer, the administrative law judge stage. So at that time, I would recommend a lawyer. But the first two, you don't need it. If you don't want it, you don't need it. Have appointment at Social Security office Monday for a disability review. Have not received paperwork. Huh. Yeah, not sure. Usually they send out the paperwork before. That's one of the ways, they catch fraud, waste, and abuse is if they get some type of tip that someone is receiving disability that shouldn't be receiving disability, the first thing they do is they send out all the paperwork and then you return it. And that way they've got proof, then, they've got the evidence that you're telling the truth or not. So yeah, it's interesting that, they're calling you in. And considering how low staffing is, that's one of the tough things is, Doge and Elon Musk are saying they're going after fraud, waste, and abuse, but they haven't found one penny of fraud. But Social Security employees find fraud every single day. People receiving disability that are not supposed to receive it. People receiving early retirement that are working, yada, yada, yada. But then you cut all those employees, and when you got no employees, they can't find the fraud. So it's kind of, self-defeating. Yeah, it's kind of ironical. But just go in there and be honest. And if you're receiving disability and you're actually not able to work and you haven't been, remember, you can work. As the trial work period, you have that 9-month trial work period. You've got, substantial gainful activity. So if you have been working and you've been staying within regulations, you got nothing to worry about. So just go in there and do the bureaucratic thing. And and whatever they tell you, come back here and let us know what come back here and let us know what they say. Dr. Oz starts soon, so things will change. Yeah, the first thing he did is he started giving Medicare Advantage companies more money. So Yeah, that's the first thing. Wow, interesting. Stocks went. Whew. I can't work while I'm on SSI disability because they deemed me 100% disabled. Well, for Social Security, everybody is 100% disabled, essentially. There is no percentage of disability for Social Security. For the Veterans Administration, they have 10, 20, 30, 100% or whatever. But for Social Security, you're either disabled or you're not. But you are allowed to work and receive SSI. The restrictions on working with while receiving SSI, the welfare-based program, are a lot more stringent than SSDI. But you are allowed to work. But if you're allowed to work, but if you're not able to work because you are in fact 100% disabled and you just can't work, then yep. Remember that the check you get in April is for March Social Security. Yes, that is a fact. You always pay a month back. Let's see. Can you recommend some attorneys who would represent? Oh, okay, I've already answered that one. It affect you forever for selling a house once? No, it's just for that 12 months. So if you sold a house 2 years ago and it's above the exclusion amount, you'll just get charged that Part B and Part D penalty for 1 year, unless you sell a house the next year and then you get it the next year. So I will be turning 65 in May of 2026. I know my income allowed goes up at 65. No, it does not. Is that for the whole year of 2026 or just after May of 2026? No, you're several years late. Full retirement age is not 65. So if you're turning 65 in May, if you were born in 1960 and after, then your full retirement age is 67. And what you said is correct if you said 67. So the year you turn your full retirement age, like this year, if you turn your full retirement age this year, starting the month you turn your full retirement age, you can make $1 billion a month. Doesn't affect your Social Security benefits negatively at all. The months before you hit your full retirement age, then you can make $62,160. So yeah, you were correct except for the age part. Can I get survivor spouse benefits if I am a high wage earner, currently 64 years old, birthday November 5th, plan to meet in person at Social Security in May and on Tricare? Want to sign up for Medicare Part A and B and B. Yeah, if you're on Tricare, they make you sign up for, reach out to Tricare. They change stuff all the time, but yeah, they make you sign up for Part A and Part B. But don't get anything else like a Medicare supplement. Definitely don't get a Medicare supplement. And I recommend everybody else get a Medicare supplement. But if you're on Tricare, no, you don't need a Medicare supplement because you're basically, be paying for it twice. But in terms of survivor benefits, if you're a high wage earner, if you're currently working now, then you might be over your, the annual earnings limit. So if you are currently working and you start your benefits, then you have to stay under the $23,400 unless you intend to stop working. But if you're asking about, let's say it's not a work type thing, but you're saying survivor benefits, yes, as the previous person we were talking about, you can collect survivor benefits first, even though your benefits are higher now, but you want it to be higher, more. So there are people that do that. They say, okay, my benefit is, $2,500. The benefits on my deceased spouse are $2,000. So I'm giving up $500. Yeah, maybe, because you're 64 years old and that $500 extra will be $1,000 extra when you turn 70. So some people say, hey, I'll take the lower amount now to get my benefits on my own record to increase, or vice versa. So check out the numbers. We're all crossing our fingers that our checks keep coming on time. Yes, we shouldn't have to worry, but here we are. It's what's the good Dr. Ed's here for. I appreciate it. Yeah, as of right now, Doge, Elon Musk, none of these guys can, stop payments legally. Congress only has that ability to give you more or less or whatever the case may be. The only thing they can do is mess up the computer system so the computer system just doesn't cut out the checks. That's the only thing that could stop your checks. But remember, all of this, we are getting distracted by all of this while the clock is ticking down to cuts. I had to start a little countdown timer or something. Yeah, that might be able to push it home a little bit. But yeah, in about 7 or 8 years, everybody's benefit is going to be cut by at least 21% unless we fix it now, because the trust fund is being, it's being depleted. It's being put in your checks. And that savings is not going to last forever. In fact, it ends 2034. We run out of money in the trust fund in 2034, and it wasn't stolen or anything like that. Yeah, we need to get serious about. We need to stop with the distractions. Politicians love distractions. They're lying because their lips are moving. Yeah, the politicians. Yeah. Let's see. True. Can I still enroll in a supplement and something to sacrifice SSDI only, original Medicare, no SSI, 65 December 2024? Don't think I would pass underwriting in Ohio, but willing to suffer lost Medicaid. Okay. Wow. You got a lot of questions there. Medicaid, SSI. All right. So you, Ari from Chapter Medicare, the guy that wrote a book on Medicare, he was on a couple of days ago and he talked about this specifically. That if you turn 65 in December, you're still good. You have like 6 months. So you can call Chapter immediately and say, hey, I turned 65. I want to check out my options. So I recommend everybody on SSDI, because when you're on SSDI, it depends on your state. I know Ohio, you can't get a Medicare supplement when you're under 65 years old, because those are state regulations, and most states don't make the insurance company give you a Medicare supplement. So all you can get is a Medicare Advantage plan, with the prior authorizations and the networks. So even if you wanted a Medicare supplement, in most states you can't get it. Or some states, oh yeah, we'll let you get it, but then they don't regulate that those companies can charge you 2 or 3 or 4 times what they charge everybody else. But once you hit 65, then there's no health underwriting. So yeah, you don't have to worry about underwriting or being denied or being charged extra. So this is your one opportunity. So I would reach out to Chapter, whoever you trust to help you out, and say, hey, time is clicking here, and I want to see if a Medicare supplement plan is right for me. And then they'll check it out, talk to you about it, and if it's not right for you, then it's not right for you. But at least maybe they can check out something else for you, or keep you on the list for October, when everybody can change. Denise, I'm starting B and D in June. I received the IRMAA letter today. Yep, that's kind of why I did this video now. Telling me of the $370 monthly IRMAA. Should I wait until I retire at the end of May to submit the appeals form? Yes. So 2 years ago, it sounds like you made over the limit, but yeah, once you retire, then submit that form, because in order to do that form, the SSA 44, you have to have a life-changing event. And it sounds like you haven't had a life-changing event technically yet. But it's April, and you're going to at the end of May. And considering how backed up offices are, you might try it. Yeah, you might actually try it. I would go ahead and download the SSA 44, send it in. They're going to put it on their stack, and they might not be able to get to it until the end of May. So you'll be like first one in line there when you actually can use it. So, but then there's also the chance, it depends on your particular office, that they get it and then they just shred it because it's not relevant yet. Or maybe, yeah. So yeah, that's kind of your call. It depends on what office you're, and yeah, it's so many variables nowadays. I really feel that any person who was born disabled should always be on Medicaid to the day they die, because they did not cause their injury, even if they had medical malpractice done to them. Yeah. If you were born disabled, I mean, that's, I like to think, as American citizens, we are compassionate about the vulnerable, and could have very well been us. We could have, I didn't choose what country I was born in, what decade or what century I was born in. And I got just pure, I won the lottery. And some people, except for the male pattern baldness lottery, but other than that, I won the lottery, and a lot of us did, but some didn't. and we need to take care of those people that, that shows how compassionate we are as a people. So, there is actually, I've heard rumblings, and I think this should happen. I think, definitely Medicaid or Medicare, whatever the case may be. And I am a proponent of, as soon as you file for benefits, whether you're 60 years old or 62 years old, and you file for Social Security benefits and you start your Social Security benefits, then you should automatically be approved, automatically get Medicare. For disability, you shouldn't have to wait 2 years. That's the stupidest law I've ever heard. You have to wait 2 years to get your Medicare. That's stupid. And then you file for, early retirement at 62, and you have to wait 3 years to get your Medicare. Another stupid law, if you ask me. So this is an opportunity to call your politicians, and, it doesn't hurt. It doesn't hurt, and say, hey, this is a stupid law. We need to fix it. And so you never know what happens. Question: I'm on SS disability, inherited my mom's house in Savannah, Georgia, but will they hold that against me? So you're on SSI, that's the welfare-based program, low income, low resources. If that's your primary house, then no. Social Security and most, welfare-based programs, Medicaid, food stamps, SSI, they allow you one home and one vehicle. So I've had people that had one home, one vehicle, and a vehicle up on blocks in the backyard, and they held that against them and couldn't get it. So, but yeah, one house, one vehicle, and you should be good. But I would reach out to them because when you get that home and you move or whatever the case may be, and you assume it, call your SSI person at your local Social Security office and say, hey, just kind of FYI, because you got to do a living arrangement change and say, hey, I'm living in this new house, or I'm, now I'm rent free, or, I'm living with, by myself or not by myself, or whatever the case may be. Make sure that way you cover yourself. But in terms of the home, it's exempt. So can I add my name to my ex-spouse? Oh, already answered that one. Let's see. Been on disability since 2007. Never had a CDR. Oh, lucky. Don't know what to expect. No paperwork. Representative payee has to come with me. Please advise. Okay. Oh, okay. So this is this is the previous one, the previous question that you're going to be meeting with Social Security here. That you never receive any paperwork, but you have a representative payee. The RP there is a representative payee. So maybe your representative payee received the paperwork and they've got questions. So just go in there and the Social Security employees, because you have a representative payee, they're supposed to talk to the representative payee. But if you're there and answering all the questions too and everything, and if there might be an issue with the representative payee. I'm just kind of throwing it out there. There might not be, but that could be one variable. Maybe that person isn't doing, not sending the paperwork correctly or whatever the case may be. If you want to be your own representative payee, if you think you can take care of your own benefits, then you tell the Social Security employee, it says, I've had a representative payee for a long time. I think I can do this myself. I'll take care of, my own benefits myself, put it in my checking account, my bank account, yada, yada, yada. And they can do that. They cannot deny you benefits to your own because they can't say, no, you have to have a representative payee. Well, some Social Security employees will say that, but they can't enforce it. Yeah. So does Medicare with Plan G pay for a CPAP machine? If it's medically necessary, I would definitely reach out. There's a great Medicare has a great app you can download. It's what's covered by Medicare. Make sure you do the official one, but it's what's covered from Medicare. And I'm trying to figure out. That's the title of Medicare.covered. What's covered? Medicare.gov. What's covered? And you just type in whatever you want. And let's see, continuous positive airway pressure devices covered. Medicare may cover a 3-month trial of a CPAP therapy devices and accessories if you've been diagnosed with obstructive sleep apnea. And then it goes into costs. It's because it's covered under Part B. Then Medicare will pay 80%. Is that a great app or what? So definitely download it. It's pretty awesome. So see how quickly I was able to research that. So Medicare will pay for the 80%, and because you have Part G will pay for the rest. So that's a beautiful thing. So it's a good thing you sign up for Part G. You don't need any prior authorizations or any of that crap. You just, if Medicare covers it, you're good. So I will be 65 on February 2026. When should I apply for my Medicare? Okay, so if you don't have health insurance from work, yours or your spouse's, and you definitely need to sign up for Medicare, then about 3 or 4 months before. So October or something, start the process. So, and you can do that online. If you're currently receiving Social Security benefits, if you're currently receiving money from Social Security, then you don't need to do anything. It's automatic. They will sign you up for Part A and Part B automatically. So, where does all this money in penalties and overpayments go? Does it go back into the trust fund? Yes. And for the extra premium and stuff like that, for Medicare, it goes back into the Medicare trust fund. Yes. Penalties, same type of thing, the extra 10%. And yes, that goes back into the trust fund. You're awesome. Oh, thank you. If I request for withdrawal of an application for retirement benefits and it gets approved, but I later decide to cancel my request, how do I cancel the withdrawal of the application request? Yeah, we've had this several times in my office, and it's like, yeah, I changed my mind. Oh, actually, I changed my mind again. Oh, I've changed my mind a third time. So it's a big decision. It's a big decision. I mean, I retired, and after a week, here I am. So I think I'm, working more hours now than I ever did, but except when I was in the Marine Corps. But anyway, yeah, no, you can. It depends on where what stage. Have you already paid back the money? If you already paid back the money, then if they've cashed that check, then you can't cancel it. It's it's done. But if you haven't paid back the money, that within that 12 months, not within the 12 months. You can withdraw your application within 12 months, but that process you can, withdraw it, but that means nothing until you actually pay back the money you received, if you received any money. But yeah, if you can't cancel it for whatever reason, it's too late, then you just file a new claim. So it's no big deal. IRMAA is more than 1 year. When I signed up for Part B, SSA imposed it for 2 years. That's because you made more the following year. It's only for 1 year. It's recalculated every year, so people will get IRMAA, the extra premium, for decades because they keep making lots of money. But they recalculate it every year, so it's only for that 1 year. But then they look at it again and they say, okay, now for another year. And they look at it again and now for another year. So stop listening to this man. Okay. All right. Part D is drug coverage. That is correct. Is Social Security benefits counts toward the IRMAA calculations? No. So, Spitfire Red, I think it was here yesterday. This is truly ridiculous. Now your Medicare is connected with things you own and sell. They have this health thing really in charge of everything you do in your life. You're controlled by the government. Okay. All right. Thank you, Dr. A. I learned so much from your vlog, and because of you, I am now dual eligible, and Medicaid is paying for my Part B premium. God bless you. Save. Awesome. So what, Gardner 03, the dual eligible. So there's a lot of people. If you know anybody that's having a hard time of it and can't afford that $185 per month for the Part B premium, tell them to reach out to their state Medicaid office, Department of Social Services, whatever. Medicaid is called different things in different states. Badger Care and Apple Care and Medi-Cal, and there's all kinds of states call it different things. But reach out to it's basically Medicaid. Reach out to your Medicaid office, and then if they approve it, the state will pay for your Part B premium. That person's, whoever you're looking out for, they will pay for that person's Part B premium, the $185. And then you're dual eligible. And then this is when I do recommend checking out a Medicare Advantage plan, because those are the ones you might be able to get some extra benefits, a grocery card, electrical assistance, transportation, or whatever the case may be. So you can reach out to Chapter and they can tell you what's available in your area. So all of those crazy stuff you see on, social media about, $500 a month for grocery cards and free ice cream and unicorns and stuff like that. They are true, except for the free ice cream and unicorns. But it really depends on what area you live in. So those grocery cards and all that extra stuff, a lot of these places, they look for the best one in the country and then they advertise it to everyone, kind of a bait and switch type situation. And you call them up and they say, well, you don't live in Paris, Texas, so sorry, you can't get it. But they are available, but it really depends on what's available in your area. So make sure you check it out. Hi, I received a disability and me and my ex, 71 and still married, but not together. Should I ask for his benefit? Okay, so you're in your 70s, you're not receiving disability anymore. So remember that. I have a lot of people that, are past their full retirement age and they're saying, I received disability. No, you don't. Your disability stopped years ago when you hit your full retirement age. You didn't notice it because the check stayed the same and everything, nothing changed. But you're just technically no longer on disability. But the importance of that is that because you're no longer on disability, we get people all the time in here that kind of freak out. It's like, I'm 70 years old. I need some extra money. And I've got a friend that offered me a job at a store. And so I'd like to work that, but I don't want to lose my disability. I'm like, you're not on disability. You're on regular retirement. You can make $1 billion a month. It doesn't matter anymore. But in your particular case, Sherry, you're still married but not together. Should I ask for his? Doesn't matter if you're not together. If you are still technically married, then you're entitled to spouse benefits. But so you had to be at least married a year, unless it's a divorce type. What doesn't sound like it's a divorce, but your benefit amount has to be less than half of that person's amount. So what I would do is I would call Social Security and give them your spouse's Social Security number. If you don't have it, no problem. Don't worry about it. Call Social Security and say, hey, I want to see if I can get any money as a spouse. And then give them the Social Security number or the person's name, date of birth, as well as it, where they were born, city and state. And the Social Security employee will be able to find the Social Security number, and they'll look at the numbers and they'll see if your benefit amount is less than half of theirs. And if it is, they'll say, yeah, you got more money here. Let's get you set up with an appointment, and they'll get you that money. So, and then come back here and tell us if you got some more money, or vice versa. Or if your spouse might get some more money on yours. So, talked with SSA today and got approved for spousal benefits. Okay. Told the Medicare would be taken out of Social Security. So far, so good. Told to contact OPM and tell them. Took an hour to reach OPM and told it is agency. Yeah. So yeah, OPM is sometimes more difficult to get a hold of than Social Security. But they're competing for worse customer service because politicians want them to have terrible customer service. So yeah, so give it over to billionaire Wall Street. Anyway, a lot of times your the $185, the Part B premium is taken out of your OPM check rather than your Social Security check, but it really depends. So Francis, thank you, Ed, to help us. You're welcome. You're welcome. Let's see. Let me get some. Will we in the near future be shipped for the first time in 90 years? Be shipped for the first time in 90 years. Shifted, maybe. That's Social Security hasn't missed a check in 90 years. Obviously personal check. I didn't get my check. No, but all checks going out. Social Security hasn't missed paying people for 90 years. So that's pretty awesome. So hopefully, knock on wood. He will, but doesn't yet. Can't apply for him to. Okay, somebody's answering someone else's question. I appreciate it. You're too awesome like that. Ed, are there any companies that sell gap coverage privately? Yeah, they're all. They all Medigap, Medicare Supplement, same thing. It's the same thing. Medigap, Plan N, Medicare Supplement, Plan N, same thing. They're all private. So you don't sign up for Medicare Advantage. You don't sign up for Medicare Supplement. You don't sign up for Part D at the Social Security Administration. You sign up for those with Chapter or whoever that helps people out with Medicare insurance that's licensed. I recommend a broker. Don't get a captive agent. A captive agent is someone that works for you mentioned some companies down there. I avoid saying the company names, but company X, Y, and Z. If you find someone that works for company X, Y, and Z, kind of the old Henry Ford, you can have any color car you want as long as it's black. You can have any insurance company you want as long as it's XYZ, because that's what they recommend. So you find a broker. A broker doesn't care which one you pick. They just want you to pick the best one for you. And the broker deals with all the companies. Well, not everybody does, but chapter, they look at all the companies in your area. And so they say, hey, in your area, there's 40 different companies and 300 different plans. Let's see what's best for you. And they spend time seeing which one's best for you. Gail, call chapter when he starts. They'll help. Yes. Give them a call. They're doing a phenomenal job. I really do appreciate them doing such an awesome job. I will be glad when it's all over. I never thought I would be going through this at retirement age. Yeah, Lori, enjoy your life. Just don't worry about this BS. I'll keep an eye on it. If anything comes up that that you should be worried about, then But as of right now, the checks are still going to be coming unless they break the system, and that's going to be broken for everybody. So we'll all be in the same boat. But there are going to be cuts coming in the future. So, reach out to your politicians, be active, protect Social Security, protect Medicare, and then, enjoy your retirement. So thank you. You're the best. I appreciate it. Dr. Oz better do right, but it's scary now. By the time last quarter comes in, probably see changes, gut feeling. Yeah. He has always been an advocate. He's always been a proponent of Medicare Advantage plans. When he had his show, he used to, have people come in and, hey, you need to sign up for Medicare Advantage. You got all these great bells and whistles and yada, yada, yada. And he wants he's, said it many times. He wants Medicare Advantage for all, that when you sign up for Medicare, you're automatically by default put into a Medicare Advantage plan. And I'm an advocate of, universal kind of healthcare, particularly for, people on disability and, kind of Medicare, that's universal healthcare type thing. It's good enough for vets. But using Medicare Advantage as that umbrella to bring that, I have issues with because of the prior authorizations and the limited networks. If they solve that, I guess maybe, but it's all about in the details. My grandson is disabled from birth. They canceled his disability monthly check. Why? Did he turn 18? If he turned 18, it's automatic that they stop it if you're receiving SSI disability. If he is still disabled, what obviously it sounds like, and one of his parents are deceased on receiving retirement benefits or on disability benefits, then the child, your grandson, might be eligible for disabled adult child benefits where they will just restart it. So yeah, you're going to have to reach out to Social Security and see exactly why they did that. And if you got any questions, whatever they tell you, come on back and let us know, and we'll, unless they solve everything for you. We only not even 100 days in and look at the destruction globally. We have both political parties ignoring the removing the FICA cap to help out Social Security. Well, one is, there's been a lot of proposals, but they haven't gotten it done. So yeah, I hold them both. One just doesn't want it to exist and wants to privatize it since day one, and the other wants to, but they haven't been very effective. So, okay, I already answered that one. Social Security was never meant to support 100% in retirement. That is a fact. Pink Owl, please hit the subscribe and share. And yes, please. Thank you very much. I appreciate it. You're too awesome. All right. Somebody talk about RFK. Would they hold it against me if I apply for the food stamps when it comes to getting custody? Oh, yeah. I don't know about custody, anything like that. Sounds like you've got some type of, child issue going on there. So, but I mean, in terms of, food stamps, it's, if you are unable to, if you have low income, low resources, then you're might be eligible for those benefits. I remember I had to get the polio vaccine before starting kindergarten. My brother started 4 years later, no polio vaccine because it was wiped out. Yeah, but Dr. Ed, so if I sell my house and buy another, I get penalized. Yes, because it's capital gains, no matter what you do with the new money. Yep, it is because it's still capital gains. What you do afterwards, that's a whole separate issue. So, Joseph, oh, here we go. I love these questions. My sister, the little old lady down the street, my neighbor, this guy at the church. I love these questions. This is all about this community. My sister is 62 on disability. Her husband just passed away. Oh gosh. And she can draw off her deceased husband first or second deceased husband. Yes. So she can choose. Social Security always tries to give people, the higher benefit. So if she was married 2 times and both of those are deceased, then we're looking at the same, up to 100%. Then yes, when she goes in, because she's receiving disability. So remember, just because she's on disability, that does not prevent her from collecting surviving spouse benefits. And it's not going to stop her disability. She's still going to have disability. And because she still has disability, her Medicare will continue. A lot of people think that, oh, when I get survivor benefits or spouse benefits, then my disability will stop. And because my disability will stop, I will lose my Medicare and I'll be without Medicare until I turn 65. That is 100% incorrect. So have her reach out to Social Security, give Social Security the names, Social Security numbers, date of birth, place they were born, whatever, to both of those deceased spouses. And then Social Security will look and see which one is more. And if one is more, whether it was the first one or the second one, they had to be married at least 9 months if they were, married when the person passed. If it was a divorce type situation, they had to be married for 10 years. So Social Security will look at both records and determine which one is the most, and then start benefits on those records. So you'll have the surviving spouse benefits, hopefully on top of the disability benefits, and then Medicare as well. So, and thank you, Joseph, for looking out for your sister. You are 3 awesome. All right, we are over an hour, and we've got the donation. Thank you, Corey. Since my Social Security office wouldn't call us back, we had to contact our senator, but my mom was approved with 100% subsidy for the extra help yesterday. All right, perfect. So thank you for the support, $5, appreciate it. So yeah, the extra help with the prescription drugs, the Medicare prescription drugs. So if you or someone you know are having difficulty paying for prescription drugs, there is no donut hole anymore, but drugs are expensive. Contact Social Security. It is one of the easiest forms to fill out. And if you're approved, then you get extra help paying for those drugs. And there's another thing that started this year. It's called smoothing. So if you, because there's a cap, a couple $1,000s cap for how much you can pay out of pocket for your drugs. But if you have an expensive drug and you reach that cap the first month, you're like, okay, I only have to pay $2,000. That's great for over the whole year, but I have to pay that $2,000 in January in 1 month. I can't, call whoever is your Part D plan and say, smooth me. And it's basically, they will say, okay, well, over 12-month period, you can pay that $2,000 over a 12-month period. So that is a brand new thing that started this year, and a lot of people don't know about, and they should. So, all right, y'all take care. Another one from Patty. Thank you. I appreciate it. You're too awesome. All right, y'all take care, and please take care of each other.